During Inslee's Stay Home, Stay Healthy order, dental offices are considered an essential business, but they've been restricted for urgent visits only. Now the offices are getting ready to reopen and resume a full scope of care. Dental hygienists asking for anonymity out of fear of losing their jobs emailed their concerns. One pointed out coronavirus can linger in the air for as long as 3 hours. How then can you protect the patient, she wrote. Another email said dentists are moving forward with opening offices with short supply of masks, asking staff to reuse masks. This email ended with the words, scared to go back to work.
What about hygienists who just say they don't think it's safe yet?
Jennifer Zabarschek, president of the Washington Dental Hygienist Association, says she's heard from dental hygienists who say their offices are ready and from others who say they're nowhere close and haven't even had meetings about it.
So she's not aware of what the protocols are going to be, what type of PPE is going to be provided, or how she's expected to complete the treatment for the patients.
When dental offices do reopen, you could see plexiglass protecting the front counter and the era of the waiting room over. Instead, you'd wait outside until the office is ready to see you. Temperature checks and coronavirus tests for patients before the appointment are also being discussed. The urgent concern is that there's not enough personal protective equipment.
And that it's not of the level that's needed for the types of procedures that we do that create aerosols. And as we know, with this virus, it can be passed through aerosols and droplets.
That's why some dental hygienists say they want to hold off on reopening and are desperately seeking direction on the safest path forward. In addition to making sure there's enough PPE, the American Dental Association says reopening dental offices needs to be a team approach with lots of communication. In Seattle, Natalie Swaby, King 5 News.